Ceftriaxone is a broad-spectrum antibiotic used to treat a variety of bacterial infections. It belongs to the cephalosporin class of antibiotics and is often administered via injection. Ceftriaxone is also known by the brand names Ceftrisol Plus and Rocephin. Ceftriaxone commonly causes gastrointestinal symptoms such as nausea, vomiting, diarrhea, and abdominal pain. These symptoms are usually mild and transient, but may require medical attention if severe or persistent. Pain, redness, and swelling at the injection site are common side effects of ceftriaxone administration, particularly when given intramuscularly. These reactions typically resolve on their own without intervention. Some individuals may experience a metallic or bitter taste in the mouth while receiving ceftriaxone treatment. This side effect is usually temporary and resolves once the treatment is completed. Rash, itching, and hives are reported as common side effects of ceftriaxone. These allergic reactions are typically mild, but can occasionally be severe. Patients should seek medical attention if they experience any signs of a severe allergic reaction, such as difficulty breathing or swelling of the face, lips, or throat. Headache is a common side effect reported by individuals receiving ceftriaxone therapy. This symptom is usually mild and self-limiting, but may require medical evaluation if persistent or severe. Ceftriaxone can occasionally cause transient elevation of liver enzymes, which may be detected through blood tests. While this side effect is usually benign, healthcare providers may monitor liver function in patients receiving prolonged treatment. Although rare, ceftriaxone can cause severe allergic reactions, including anaphylaxis, which is a life-threatening emergency. Signs of an allergic reaction may include difficulty breathing, swelling of the face, lips, or throat, and hives. Patients experiencing these symptoms should seek immediate medical attention. Prolonged use of ceftriaxone can disrupt the normal balance of bacteria in the gut and increase the risk of developing Clostridium difficile infection, which causes severe diarrhea and colitis. Patients experiencing persistent diarrhea while taking ceftriaxone should notify their healthcare provider promptly. Ceftriaxone can cause severe hypersensitivity reactions, including Stevens-Johnson syndrome and toxic epidermal necrolysis, which are life-threatening skin conditions characterized by blistering and peeling of the skin. These reactions require immediate medical intervention and discontinuation of ceftriaxone therapy. Prolonged use of ceftriaxone, particularly in neonates and infants, has been associated with the formation of biliary sludge and gallbladder disorders such as cholelithiasis and cholecystitis. Healthcare providers should monitor patients for symptoms of gallbladder dysfunction, such as abdominal pain and jaundice, during ceftriaxone treatment. Rarely, ceftriaxone can cause blood disorders such as hemolytic anemia, leukopenia, and thrombocytopenia. Patients may experience symptoms such as fatigue, weakness, pale skin, easy bruising or bleeding, and fever. These side effects require prompt medical evaluation and may necessitate discontinuation of ceftriaxone therapy. Ceftriaxone is often prescribed for the treatment of respiratory tract infections, including community-acquired pneumonia, bronchitis, and exacerbations of chronic obstructive pulmonary disease. Its ability to penetrate well into lung tissues makes it an effective choice for these infections. It is the drug of choice for treating certain sexually transmitted infections, particularly gonorrhea. Due to the increasing prevalence of drug-resistant strains of Neisseria gonorrhoeae, ceftriaxone is often administered in combination with other antibiotics to ensure effective treatment. It is utilized in the management of intra-abdominal infections such as peritonitis and cholecystitis. Its broad spectrum of activity against both aerobic and anaerobic bacteria make it an effective choice for these infections. It is one of the primary antibiotics used in the treatment of bacterial meningitis, a serious infection of the membranes surrounding the brain and spinal cord. Its ability to penetrate the blood-brain barrier and its effectiveness against the common pathogens responsible for meningitis make it a crucial component of treatment regimens. It is often administered prophylactically before surgical procedures to prevent postoperative infections. It is particularly useful in surgeries involving the abdomen, genitourinary tract, and orthopedic procedures. Ceftriaxone may be prescribed for the treatment of Lyme disease, especially in cases where the infection has spread to the central nervous system or when oral antibiotics have been ineffective. It is commonly used in pediatric patients for various bacterial infections, including pneumonia, otitis media, and septicemia. Its once daily dosing and broad spectrum of activity make it convenient and effective in this population. It is an important antibiotic in the treatment of typhoid fever caused by Salmonella typhi. It is often preferred due to its high efficacy and the increasing prevalence of antibiotic-resistant strains. In cases where the causative organism of an infection is unknown, ceftriaxone is sometimes used as empirical therapy due to its broad spectrum of activity and low resistance rates. Ceftriaxone works by interfering with the synthesis of the bacterial cell wall, leading to cell death. Specifically, ceftriaxone binds to and inhibits the activity of penicillin-binding proteins, which are enzymes involved in the final steps of bacterial cell wall synthesis. The dosage of ceftriaxone varies depending on the type and severity of the infection, as well as the patient's age, weight, and renal function. It is usually administered intravenously or intramuscularly. It's crucial to follow the dosage instructions provided by the healthcare provider or pharmacist. When using ceftriaxone, it's important to be aware of several warnings to ensure safe and effective treatment. Patients with a history of hypersensitivity to cephalosporins or penicillins should use ceftriaxone with caution. Dosage adjustment may be necessary in patients with renal impairment to prevent accumulation of ceftriaxone and potential toxicity. Ceftriaxone should be used cautiously in patients at risk of biliary complications, particularly neonates and children. Ceftriaxone may interact with other medications, such as probnicid, leading to altered drug levels in the body. Healthcare providers should be informed of all medications being taken concurrently. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.